Stacey, are you ready?
I am indeed. I was born ready.
I love it.
Hmm.
Welcome to Cancer Bites, bold voices, big insights, and unstoppable energy, because cancer doesn't get the last word.
Welcome, everybody to Cancer Fight. And this is the place where we look at real stories that are going to inspire resilience and hope. And we think today's guest proves that, what it is to be strong is also to be bold, brilliant, and just absolutely beautiful inside and out. And I want to introduce Kellie Whitton. She is a powerhouse marketing executive, and she's founded this amazing product or idea called CaraKit. And joining me today is going to be the founder of Cancer Bites, Siobhan Shaw, my amazing friend. And she's actually also on the advisory board of CaraKit. So I'm going to jump right in and chat a little bit with you, Kellie, and I'm
Yeah.
going to tell people, your background at Warner Brothers. You led, international marketing campaigns, and I know you still have a hand in that. And before you launched CaraKit, you spent more than 2 decades shaping global entertainment at Warner Brothers. And we know, as I said, you led international marketing campaigns, including to do with Barbie and Superman. And, I was reading about you and I thought, you know what, you're one of those behind the scenes powerhouses. You're really creative and amazing, and people just think it all happens by magic, but you are the magic. And you know what I mean?
I need that
So
on a t-shirt. I will
I
take it.
know
Thank
I'll
you.
have to put that on the t-shirt for you. You're the magic. But I think it's not just your professional success we're focusing on here. It's how you use this kind of storytelling to really and leadership to build something that's amazing, can help so many people, but can be so personal at the same time. And we will share, as you know, you were diagnosed with breast cancer that later became metastatic. We know that this cancer has migrated to your brain, but you're not looking at this at this point from a point of view of being tragic. You've turned
No.
it into this incredible mission that has become CaraKit. And CaraKit, for those of you who don't know, are these beautifully curated care kits. And they bring comfort, they bring dignity, and they bring empowerment so that you can focus on what is empowering in your life and
Yeah.
what is when you need it most. So, you know, just I'd love to hear a little bit about, Kellie. I've introduced you, so we know you as an executive and the powerhouse and the magic, but what was the transition like from that to becoming a patient and then an advocate in the space?
Yes. Well, thank you so much for having me on. And, I just applaud every single person that is out there spreading the word and showing women that are living with and through cancer. I think it's a beautiful thing, especially for those who are fighting it now. I try as much as humanly possible to offer a hand and to get out to people who are going through it, because people did that for me in the
Yeah.
process. And it was my greatest lifeline to feeling like there was hope and there was a future ahead of me. And so I try and do that as well as much as possible, as you guys are doing right now, which is beautiful. So, to be honest, I absolutely love my job. I think it is,
Right.
it's truly
Yeah.
incredible. I studied journalism in school. I was a weekend news anchor at a tiny NBC affiliate in Missouri, which is where I'm from. And then I decided that film was the place for me. So moved into publicity and then into marketing. And my father is Italian. I studied abroad in Spain, or I'm sorry, in Mexico, and spoke Spanish. I have learned a lot of Italian. My dad has cousins that are still there. So I always have felt like a connection to the greater world was a place for me. And that was really what this job did. And I thank the mentors and the people who have helped guide me through, but my job really is speaking to, the really 20 biggest countries around the world, although we distribute in many more than that. And the idea that we would have, an objective like putting Barbie out, and I would be talking to, Europe in the morning and Latin America in the middle of the day and
Yeah.
Asia Pacific at night. And I was connected with all of these people in a very real and tactical way, right? Of getting
Yeah.
movies out in every country. But what I have found through a lot of years of doing that work is that people are people are people are
Yeah.
people. We are the
Mhm.
same. We care for our families. We want safety and security. We want a nice place to live. We love our homes, these places that we can
Yeah.
create for ourselves that are that are our own spaces. And of course, there are differences culturally between all of us, and that is a beautiful thing too. So, I have friends in all of these places around the world, and I cherish those friendships. But in the process, obviously, of going through a cancer diagnosis, to be honest, I was diagnosed in 2020, 2 weeks after the COVID shutdown.
Wow.
I had been in London at the end of February and we were talking about the Wonder Woman 1984 campaign with all of our European offices. I get home, they shut everything down. And in that process of trying to understand how we were going to live in a COVID environment, I felt a little weird spot. And I had just gone in for a mammogram a couple of months before that. I was very regular. I had had them for 5 years. And I went in and it was crazy. It was that moment where no one knew what to do with COVID. So I just remember going into the place of the mammogram, and all of the chairs from the waiting room had been moved outside. And obviously all of the nurses have masks on and you can only come by yourself. And I just remember going in and getting an ultrasound. And I remember the tech, you know how techs are like, they're not supposed to tell you anything. And I just remember that moment where very often techs are like, it's going to be okay. It's fine. And I just remember her, I was like, can you say anything? Can you say what it is? And she was like, oh no, I can say nothing. Your doctor has to tell you all of this. And I was like, I think I have this. I think something's happening. So I remember getting the biopsy and I've told this to other friends who were in the process of finding something and potentially getting a biopsy. And I say, listen, I've been in cancer treatment for 5 years. And the 2 worst days of treatment were the 2 days between when I got the biopsy and when they called me with the results. Because at that point, you don't know anything. You think every worst case scenario is going to happen to you. And my kids were 2 years old and 5 years old at the time. And I just remember sitting in a rocking chair, holding my 2-year-old as he was going down for a nap. And I was just trying to make deals with God at that point. I was like, I will do anything to see my children grow up. I will do anything you want. And it's funny because my spiritual relationship has changed so much in that amount of time, because it has to in this process. But I remember being so desperate for anything that I could work with. And amazingly, I was diagnosed with stage 2B, 3A breast cancer, and they had to go in. I started with chemo, so 6 rounds of chemo. Then I did a lumpectomy, which turned into 3 lumpectomies because they couldn't quite get all of it and get the margins that they needed. So I had 3 in a row. And then I did 30 rounds of radiation during Thanksgiving and Christmas and the New Year. And, it's funny because radiation, you still have to keep going. So, I would be there on New Year's Eve and Christmas Eve and go in and do it and then go back. And, with my children, especially, you're not explaining to a 2-year-old and a 5-year-old that I'm going in for cancer treatment. Everything is just fine. And in some ways that was a blessing, because when I was with them, I was just mom, I wasn't the lady with cancer. And, I have found that, and please interrupt me anytime, because Lord knows I could talk about this for ages. But
we're here to hear you. We are here to hear your voice.
That's good. Yeah, I mean, what I found from the people that I called and talked to, and obviously it was COVID time, which worked very well because it wasn't like I could go out anyway. I was immunocompromised during chemo, especially. And so, in some ways it worked out very well. For my husband, it probably didn't, because anytime I was feeling down, it was him and only him. And he was taking care of me and the kids at the same time. But, it's a process of caregiving for someone with cancer that I don't think people really understand. I was that person that if someone that I knew, and it happened to me with a woman at work who was going through chemo, and she would show up at work and she, bald head, and she was going through the entire thing and she just powered through everything. It was funny. She's the one who buys media for all of our releases. She would spend like billions of dollars a year, whatever it was. And she was just a powerhouse. I've never met anyone like her. And she just powered through all of it. And I remember I was a person who didn't know what to say. I was uncomfortable. I was like, I'm so sorry. And whenever I was diagnosed, all of the sorries, all of the sympathy, all of the, oh, I can't believe it, all of it was really hard. It's harder than you imagine it to be, because instead of someone saying, hey, you're going to be great, don't even worry
Yeah.
about this, like, how you doing, what's going on, you know, I was the sympathy person, and then I
Yeah.
realized sympathy is not what people need. They need encouragement, right?
Yeah.
And they need
Yeah.
a clear slate ahead of them to be like, you're going to be fine. So I spent all of my time, when I could, sort of sadly at the time, although the woman I was just talking about gave me the best advice, I'll tell you in a second, but sort of going through that process of not being able to answer all the sympathy
Yeah.
because it was too much. I couldn't put out
Yeah.
the energy, right? I was
Yeah.
feeling too low myself. But any of the women who had cancer would be like, hey, what's happening? How are you feeling? What do you need? What, you know,
Interesting.
what side effects are getting you down? What's happening? And they took a really practical approach to
Yes.
everything.
Yes.
And I appreciated that so much. And they would be like, hey, there's soup on your front porch, go get it, you know.
Oh,
You know,
oh,
it's
that's
fine. Like, they would
wonderful.
send books, and yeah,
Yeah.
little, it's funny, I'm wearing one now,
Because I
but
was
this says,
noticing it. It's
yeah.
lovely. I was looking at
Well,
your
I would
website.
say one friend
Beautiful.
sent, this is from Haiti, actually, a woman that
Oh,
made all of these for breast
yeah.
cancer, which was amazing. Haiti sadly is going through some tough times, obviously,
Yeah.
now.
Yeah.
But this one, which I love, I don't know if you could say it, it says,
Gorgeous.
you're
Yeah.
stronger than you think, which
Oh,
I
wow.
love.
Kelly, that
And
is
I would wear
beautiful.
it right into treatment centers and the rest. And I just, you know, you need to know that. And
Yes.
anytime a friend would say anything like, you're a powerhouse, you can get through this, don't even worry, I'd be like, yeah, you're right.
Yeah.
I can do
I
this.
love that.
Right? Because you don't think you can at the time inside, right?
Yeah.
You feel like you're a tiny little mouse of a person, that you've got nothing there. And when people would be like, no, girl, you're gonna do fine, you got this, I believed every word.
There you
I
go.
needed it, right? Right? It's
Yes.
so wild.
Right.
And the woman I was talking about before that came to work during chemo, I emailed her when I was going through breast cancer, and then she wrote back. And sadly, my second round of chemo, I had a root canal that failed, so they had to do oral surgery.
Oh,
And
my
my
goodness.
port, which I was saying I still have the scar, they put in my arm, and then I ended up with blood clots all the way through my shoulders. I remember going in, and they did the ultrasound on that, and they were like, can we call your doctor right now? It was like a Friday at 4:30. And I was like,
Oh my
that's not a
God.
good sign.
Right.
Yes. So, yeah.
Uh-huh.
So anyway, so I didn't write her back for a few weeks after she wrote to me, because I was going through all of that. And so I wrote her back, and I was like, oh, I'm so sorry. And it took me so long, and I really apologize. And she wrote a note back to me. And I tell this piece of advice to
Yeah.
anyone who will listen, who's going through it. She goes, stop saying the word sorry to
Nice.
me or to anyone. She
Nice.
said, you are in a moment of healing for yourself. And
Mm.
it doesn't mean you have to go around to everyone and be like, this is about me. That's not what it
Yeah.
is, obviously. But you need to protect yourself. You need to
Very
guard
good.
yourself. And whatever you think society and your friends and other people need from you, it's not important right now.
Very good.
If that's going to give you worry about you making sure you're meeting all their expectations, get it off the table, because that's not the important thing right now.
That is
Right, Siobhan? Like,
amazing
I know you
advice.
feel it too. It's just a
Yeah,
saying, right?
that's amazing advice. And that right there to me is the kernel of the advocacy. I'm sure, Siobhan, you can chime in there for sure.
Everything that Kelly's saying is what happens. Now, we're on totally different treatments, and I feel very fortunate to be on an innovative drug that's only been approved about a year with the FDA, but it's been out 10 years and people are surviving 10 years. So you know how they said, oh, Siobhan, you have 6 years to live. That was the initial, comment from the doctors and the first oncologist until I changed my oncologist. I said, can I change
Good.
my oncologist?
Good. Yeah, good
Yes.
decision.
And then she came in and she goes, we're going to destroy your cancer.
Yeah.
Amazing.
And it's
that's
happening. And I have those, everything you said, I wrote it all down.
Yeah, it was.
I did the dealing with God.
Yeah.
Yeah.
I was there all by myself John would come and go, but it was me in the hospital. you know, John wasn't sleeping overnight or anything like that. You know,
Totally.
he couldn't. I was hooked up to machines. I was alarmed into my
Yeah.
bed because I was so weak. And it frightened me and it shocked me. And it was like, wait a minute, I'm strong. I'm a farmer. I'm, you know,
Yeah.
I come from a, you know, strong stock, you know.
Yeah.
It's just
Yeah.
what is happening to my body? And then
Yeah.
the fear of like, oh, 6 years? Whoa, that's not very long. And what's going to happen to John? I mean, well, he'll never find another woman like me.
There you go. Exactly.
That's
Right?
when I started to bring that humor back into my life.
Yes.
John
Yeah.
always brings it into my life. Humor injections were a big part of it.
Yeah.
The faith as you are dealing with you're bargaining with God. I was bargaining with the doctors. I still didn't believe them. I said, no, this is some sort of case of asthma or some really bad allergy. It must be such a bad allergy.
Yeah.
Or when I fell because I slipped because the dishwasher had overflowed, I must have jarred something and that created a hole in my lung pleura, and that's why my body fluid is, you know, I must have a pneumothorax. And they were looking for all those things, but they knew.
Yeah.
They could tell from the CAT scans that my body, like I had, you know, I have big, I can't feel it, but there's a big tumor on my spine. And then the faith deepens, and I don't know what it is, that quiet time where you have to deal with, you're facing eternity, and eternity without all the people that you love, because you're not going to be on this earthly plane anymore. You're going to the next phase. You know, I was watching a video today where these two twins in the mommy's tummy, basically in the womb, are talking to each other. One believes that there's something beyond delivery, and the other says that can't be anything beyond delivery. And it was you know, I'll post it because it was so great, but it's the same thing with us, right? You get to this point where if you didn't believe in God, you're calling out to him. You are like,
truly,
God, just save me, like, show me, what do you want me to do? How, you know, what is it? What's my purpose? How do I stick around? You know, how do I help people? Like, you just get into this, and God gives you those answers. CaraKit.
Yeah.
And you have to listen. You have to obey.
Yes.
Yeah.
And I also think the materials that you need at the time, like I have this book that I just read that I love. I've always been the person that gears a little more towards science than sort of cold, you know, like faith-based religious talk. And there's a book that is called Proof of Heaven, which is a neuroscientist who has basically a completely random bacterial infection that the odds are like 1 in 10 million that he would have this, and he goes into a coma for a month, or sorry, for a few weeks, and every part of that process, they basically are like, he's brain dead, there's nothing that can be done, we're going to have to turn off the machines at some point. He comes back within a month. He is talking and exactly as he was before. Within a few months, he's able to remember all of the neurosurgery. They say there's no way that this is possible. But that entire time, he has basically a massive near-death experience. And he writes the entire book about the experience that he has. And he's like, listen, I'm a scientist. When people would say near-death experiences, I was like, okay, I wasn't going to poo-poo what they said, but I also did not believe anything that they were saying. It was just some weird scientific thing that we haven't figured out yet. And he's like, all of that is crap. You have to understand my experience and what I went through. And I am here that I have to just relay everything that happened in that experience. So anyway, it's a good one, Proof of Heaven. But, you know, there are lots of books and other things that come to you at the time you need them, right?
We have to invite him on the show, Stacey. I wrote the book.
Yes.
Listen, I will be on that Facebook Live watching. I'll be like, oh my God. So good.
Awesome. That is awesome. So, I mean, I think so much of what you've said, you know, you brought in that idea of a sense of purpose and how important it is to care about others, the sense of community. And I think, you know, that you know, among your children, it was great that you were, quote unquote, just mom, even though, you know, no one is just mom, but you were mom and you could live in that reality and in that space. And I think you know, when you look at moving from the idea of fighting against cancer, but embracing life, I think it sounds as if you have found a way to live with the diagnosis in a way that's
Mhm.
positive. We'd love to hear more about that,
Yes.
Kelly, for sure.
Well, to be honest, I think a lot of it has to do with the doctors. And Siobhan, that what you said about changing doctors, I think that
Yeah.
means everything. What I have found, even from my neurosurgeon who did brain surgery, my oncologist, at no point are they, even my breast surgeon, the last time I was in her office and we met, I get mammograms every 6 months. I see my oncologist every 3 weeks. Like I do a lot of appointments, right? But she said, listen, this is a chronic illness. Like you manage it the same way you would manage any other chronic illness. She told me a story of a friend of hers that had something happen to her shoulder and she thought it was just reoccurring pain from something she was doing. And she had massive, potentially terminal cancer. And she's like, she's in year 4. She's doing great. Everything is managed. She said there are amazing drugs. There has been amazing progress due to research that has happened, right? And all of that is, I think, because people are spending time. They're spending funds and money. There are great organizations that are out there that are doing the hard work, right? I love October because it's Breast Cancer Awareness Month, and people talk about it for that time. And there are other months and other times for other cancers and other illnesses, but it's critical because if we go back to the time, 100 years ago, where obviously communication isn't the way that it is, and also there are things you don't talk about.
Yes.
That doesn't make any sense, right? We're all going through this. I love that women are doing it about menopause. It's just something that we're all in a process of dealing with. And I think the more that you understand that other people are in hard places, but they find a way to motivate themselves in a variety of things. But mine was partly with CaraKit because Lord knows I can't just sit around. I did it while I was in treatment for breast cancer, right? I'm just like, all right, I'm not gonna, I tried crocheting and some cross stitch and I was like, by the way, I still do it because I think it's great, but like, it's not for me. It's not like full-time job. So, I just remember having that moment. We all have these moments, right? My husband is great about saying this of like, God, whatever you believe, the creator gives you things in your mind. Like my religion is like partly ideas, right? You get ideas from a variety of places that you don't know. That's not necessarily from your experience that you had in childhood or the person that you met down the street. These are beautiful, amazing things that just come to you. And if you do nothing with them, they're always coming to you. It's like this little disease that just lives inside of you of unrealized ideas, right? You have that idea that is special to you. And mine came when I was first diagnosed and I got all of these beautiful gifts, which by the way, I thank every single person that sent any single thing. Like your love and support means everything to me. But it would be like, socks that said F cancer. And I was like, I don't want to see the word cancer in my house. Like I've only said it with my name like 3 times and I have to go through chemo and like, I don't have any identity related to that, or things with the pink ribbon on it, right? I wear it now, but I'm like, I have no connection to this. It's not me. I don't understand why you're sending me all of this stuff. So, and they would send flowers and food baskets and all of it with the best of intentions. And Lord knows I have done the same thing. But then I would be on Amazon on my phone being like, all right, I have to redo my entire bathroom and I can't use all the gels and soaps and everything else that I've used. And I was doing a cold cap to save part of my hair. And the only thing I could use were like sulfate-free shampoos and coconut oil. So I smelled like a dirty beach for like the entire time I was going through chemo, which was gross, but that's the way it goes. But I would be buying all of those things. And I was like, why isn't anyone putting these two things together? Come on, folks. Like we need certain things to replace our world that are still nice, that are still lovely, right? We can't use dyes and chemicals and harsh fragrances and so CaraKit stuff, it wasn't just me, it was all kinds of people. It was like, put some essential oils and we do a bracelet that has like 4 wood beads. So you can put essential oils on the wood and take it into an infusion center or a doctor's office that don't always smell the best. It's just the way it goes, right? Or it smells like bleach because they're cleaning everything all the time, right? And the best item that we put in, this is like a revelation. It's the first haircut I got, again, my dirty beach hair, after chemo, was from a woman. This again during COVID time, so we weren't going into salons. I went to her house. She was a friend of a friend. She had breast cancer, and I was getting my hair cut outside her house. And she was the one, you know, Flo in those Progressive commercials, the brown haired girl, that's right. So she does film and TV hair, and she does Flo's hair. And I was like, that's amazing. You're so cool. Awesome. And I was like, listen, what do we need to put in these kits? Because I want to do these kits for people who don't know what to get. And she's like, oh my gosh, you have to put in one of those lint rollers, like the ones with tape that you get from like Target or Amazon or wherever. And I was like, because I didn't lose all of my hair, I lost some. And I was like, is it like the early hair that's falling off? Like, why would you do that? And she's like, no. Whenever you have hair coming out, and it happens a couple weeks into chemo, and it happens in little clumps, right? And then all of a sudden you have too many clumps, and then you need to shave your head. And she said, whenever you shave, you still get little hairs that are popping out that aren't caught by the razor. And she said, all you have to do is rub that tape lint roller over your hair. She said, I would do it every morning, and then I would put on my wig, or I would put on my scarf, or whatever I was going to do. And it was like beautiful, and I could go out for the day, and I didn't feel any other weird hairs popping out. So the first CaraKit that I ever did was literally putting everything into an Amazon box that I had, and I sent it to a woman who was the wife of a guy I used to work with, but I saw it on social media that she was just starting, and I was like, all right, girl, I got you covered. I was like, I sent a note to her husband. I was like, I'm going to send your wife stuff, like send me your address. And so I sent her the box, and then I sent her an email with like a list of all the stuff in it and how and why to use it. We do that in the kits as well, because like you wouldn't know what a lint roller thing is for. Like it's just, you know. So I sent her all that stuff, and she was like, she like has 2 little girls, and she was, you know, busy and crazy and all of it. And she's like, I just put it in the closet. I was gonna get to it all. But she said, I remember, and she told me this a few months later. She's like, I remember being in the bathroom. My mom was there watching the girls. My husband is there shaving my head. I am sobbing, but I don't want the girls to see. She's like, it was the most emotional day. And she said, so we get done with that. I pull my stuff together. I go out for the girls to talk. And she's like, I'm trying to convince them not to shave their heads now because they want to look just like mom does. She's like, so the whole day was just full of emotion. And she said, I go to lay down that night to go to sleep, and I lay down on a pillow, and I felt like needles were sticking me in my head. And she said, then I remembered your email and your box full of stuff. And she's like, I went over, I pulled out that lint roller, I went in the bathroom, and I lint rolled my head, and I laid down, and it was smooth as silk. And she said it was the only thing that saved me that day to be able to go back and go to sleep. And she said, you just wouldn't know this if people aren't talking about it, if it's not something that this beautiful hairstylist told us, right? That you just don't know. And then it's like insult to injury, right? You're in the most painful time, and it turns into more pain, and you just think the world is against you and everyone's against you. But if we're out here telling people, listen, just get that thing. It's $2 at Target. Even for the CaraKits, people are like, it's expensive. And I was like, yeah, organic stuff made in small batches without all the stuff is expensive. We do not charge more than all of those retail items together, because I won't do that to people, right? We are turning into a nonprofit because I have not made a single penny on CaraKit because I give out kits to anyone who needs them, right? So I was like, well, we're operating like a nonprofit. We should just be a nonprofit. Like that's the way it goes, because people need this. But on the website, I include every item in every kit. And I'm like, listen, if you can't get this kit, it's okay. Go to Rite Aid or CV. I guess Rite Aid is like a CVS or Walgreens or wherever you need to go. Help your friend however you can, right? Pay attention to those details, though. Don't get stuff full of scents and chemicals and other things, right? But you can find other versions of that, and you can make your own little basket, and you can give it to someone who needs it. We put a lot of care and attention into the products and things that we use, but anyone can do this, right? You can find practical ways to help people. You just need to know those details, and you need to know it from people who have been through it. And again, it's not my battle, it's all of our battle, right? And I tell people all the time, I'm like, tell us what works for you. If you find something that's on there, we'll put it in the kits, or we'll write about it, or we'll let people know, because the information sharing, people love to hold information, right? Be like, I'm the only one with this information. And I'm like, screw that. Like, that information is not, I would say it's not power in the way of making yourself feel better, right?
Not
It
at
is
all.
power in a way of helping as many people as you possibly can. So
Exactly.
Lord knows, I'm not saving the damn lint roller story for people who go and shop and buy it. I was like, that's crap.
Yeah.
Like, tell your friends, tell anyone you need, right? That's I have a good friend who's going through, she just did her first round of chemo last week, and I took the whole kit over to her and I was like, listen, I hope none of these things are useful to you, to be honest. I hope one day no one needs a CaraKit because cancer is cured, right? I am going to tell you about the things that happen in my journey and other people's journey. But by the way, may not happen to you at all. And that's the best news ever, right? We can only deal with the stuff that happens to us. That was the other thing I didn't realize going into it. All treatment was like, my body's going to react differently than your body and your body and your, that's just the way it goes, right? We're all unique creatures in our own ways. So maybe you're going to have an allergic reaction. It's going to be tough and your doctors are going to deal with it, and that's all right. And maybe you're not going to have any reaction at all, and that's okay. And, you know, I was talking to Eli, who I was telling you about it before, Siobhan. She does, her company, nonprofit is called Eli Sunflowers. And she got cancer when she was 14. She had 14 rounds of chemo, plasma radiation. She tries to help teens all the time because she knows what it was like in that process. And I just forgot what I was talking about. This is going to be a brain cancer. Anyway,
That's
whatever.
called cancer brain. I go
about
cancer brain. That's
mother.
get away
we were talking about
Lord.
CaraKit.
I was like, she's so great. She's so great. Okay. Anyway, it's important to know, as many details as you can about the process this year. Go ahead.
It is, you know, it is important for us to share. And I think what you're showing us is that there is a universality to this message, even in as much as it's an individual journey. No one's journey looks alike, but we're going through it together in solidarity. And what I love about CaraKit, I mean, so far I love everything, but I also really love that there's the practical side of care that feeds into such emotional well-being, right? And that's really important. And I think that's something that really resonates with you as well, Siobhan. I mean, because you are on the advisory board of CaraKit, so I can imagine that that's part of what drew you into that. But
first of all, I am honored to have been assigned. I don't even know what they call it. I have my own advisory board, but when you asked me to be part of your advisory board, I was honored. And then when I went to see who I was sitting on that board with, I was like, oh, little old me. What can I bring to this conversation? But maybe just realism, right? This is the way it is, and there's so much you're saying that absolutely has happened to me. You know, when you were talking about the pink ribbon, I have to tell a story. So when Kellie and I first talked on the phone, we had a great conversation, and she told me about how she didn't like the pink ribbon because she wasn't a survivor. That's the reason, right? You didn't like the little pink ribbon because it represents survival. Well, we're not in that space yet. We're living through it, right? And metastatic breast cancer means for life, right? Whether or not you've gone into remission or not, it is a chronic disease. You now have it for life. So you're tied to the medical system, and you have to go in and do what you have to do, the scans and the doctor's appointments on a regular basis. And each one of us seems to have a very different schedule and treatments. But when you said the pink ribbons, now this was early on with Cancer Bites, and guess what? I had this sort of weak looking logo with a little pink ribbon. And I had a little bite out of the pink ribbon, but I'm not a graphics person. And as soon as I got off the phone with you, I went, that's out. I want something that's powerful, that's strong. And I went to Canva AI, and it created something with the colors I was looking for right here. And then, but the problem was you can't change some of the graphics, right? And so there was this sort of role, and I showed it to John, like at the bottom, you know, down, I don't know if you can see sort of where the small print is. There
Yeah.
was this thing that was like a roll, and I showed it to John, and he goes, "That's poop."
Oh no.
Oh, that's hilarious. Oh, we can't hear you, Sean.
My squeaky little
Oh, there you
voice. And he said, "Don't worry, I got Photoshop. I can take care of this." And he took care of it. I don't know how he fixed it, but this is what we ended up with. And I think I love it. And I love the
Yeah.
Totally.
colors that are bright and bold, and
Yeah.
the text is bold and it looks good. And now I'm using all these colors in the, you know, the YouTube channel where the show is, and where our gratitude spotlights
Yeah.
are for our sponsors, and you know, my vlog is, and I'm using those colors, and it's brightened up the channel, because it's part of our growingtogive.org channel, which is a lot of greens and things like that, because we're in food security and agriculture and community farms and the Phoenix Food Forest. So it's kind of like boring green. This is livened up the page, because Cancer Bites, of course, is a campaign under the auspice of growingtogive.org. So, and as you said, you're going to start a nonprofit. I'm 100% behind that. I think that's a great.
Thank you.
That
Well,
is a wonderful idea.
to be honest, again, we don't make money from the kits, really. I mean, I call it my kids' college fund. I've invested a lot into it, but we haven't made a penny back. I'm like, oh, that's the way it goes. Because I do think there are things that are more important than money, to be honest. I know we all need money to live. I totally get it. But the idea that there are gazillion billionaires out there and they're just sitting on these funds, and there are people who are hungry and who are suffering, and to me, it's incomprehensible, to be honest. So you know, there's a need for as much help as possible. So the idea will be that people can buy the kits for their friends and whoever they need, but that all of those proceeds will go to the gazillions of emails that we get all the time of people just saying, listen, I would love one of these, but I don't have anyone supporting me, and I don't have any funds or any money. You know, we keep a box of just samples and other things that if people need things, we just send them things, whatever we can, because if it's coming free to us, it's going to go free to you, and we're going to pay that shipping and do whatever we need. I got the nicest note from a woman we sent a bunch of things to, and she was like, you have no idea what smile this brought to me. And she said, I'm a single mom with 2 kids and I'm going through this, and you just don't think that anyone is there to help you, you know. And there are people going through this by themselves, and that breaks my heart, truly, because it's hard enough to go through it, to not have that support and love and care of people that are around you. So I just think any way that we can help them is what we want to do.
Of course.
That's why I love CaraKit and Kelly, and I know that we're going to be working closely together for a very long time, because we're aligned in so many ways. And Stacey, you know, you talk about seed sisters or soul sisters.
Yeah,
I feel Kelly is one of those, and she gets it. She's awake, she's aware, she's working towards helping other people, and it's a beautiful thing. And when I stepped into this space, I had no idea what to expect. But I love it. I am excited about it. We're doing, of course, the Gifts That Heal and Give Back guide. I don't even think you know about that yet, Kelly, but we have every day, I have a whole bunch of packages that arrive from companies, and these are editorial samples, right? So like this candle is amazing. We actually got it for our gift bag, so we have 60 of these, but matches. The color is amazing.
Yeah, it does.
And the woman has joined our titty committee, so anybody that wants to volunteer and join our titty committee, there's always a job for somebody to do. If you have a skill, especially if you do social media marketing, please help me. But these are the kinds of things we're getting, and like you, there'll be a lot of things that the gift bags will go out, and all these one-off editorial samples, if I haven't used it, I haven't slept in it, and I haven't opened it to, like, you know, lather all over my body or wash my hair, because there's so many samples coming in. What is so cool about it, Kelly, is that most of those have stories of breast cancer. The
Yeah.
founders
Yes.
of these small
Yes.
companies are reaching out because they're going through it or they've
Yes.
survived it and they
Yeah.
want to help. And they are so excited to just be in the guide, to be able to
Yes.
send something. One of them says, I said, "Oh no, I'll be giving that plushie away." And she said, "No, he's yours. He's coming to live with you."
Oh,
And I'm like,
Oh.
yeah.
"Oh," and of course, now he's like taken over the couch. John is
No,
going to
no.
redesign the house for the plushies that are coming in. There was 2 that came in yesterday, and John goes, "Can I have that one?" And I'm
Oh.
like,
That's so
and he
sweet.
said, if that one is this one over here, a little girl would love that one. Like
I
he was
love
already, he wasn't going
that.
to keep them all for himself, but I'm like,
Oh.
here's this big strapping, man, 6'2", eyes of blue. And he's like, "I want that little plushie." Like,
But it shows the power of those things, like little
Exactly.
items, right? They have a
Exactly.
lot of power on us, bizarrely, right? And a lot of people use shopping therapy and other things, right? But the gift giving, the delivering of something,
Yes.
we have folks that tell us that they get our kits, and we've had pictures of this where they have the instruction card and they have laid out every item around their bed, and they'll take a picture of them with all of
Yeah.
the stuff. They have their PJs on, and they're like, "This means everything to me," partly because of the stories that are on there to say, this is how you use it, this is what you do, because we're taking that idea of someone who has also been through it, of a variety of people that support, and we're letting them support you in this process. And it's funny, we have Patty, who is on our board as well, who is the co-owner of Dr. John's, who is a sugar-free candy company, right? She has been through it all. And whenever we started putting Dr. John's into the kits, I ended up talking to her, and she's like, "Listen, I have been through it all." And she told me her cancer story, and she said, I don't talk to people about this because this is just something that, when I was done, I wanted it to be done. And she said, to be honest, I am empowered now. I think we should talk about it. And I want to tell my kids and my grandkids, and I want to go through the stories. It's amazing. And so hopefully we can keep empowering other people to do that as well. By the way, I remembered what I was going to say about Eli. You ready?
yes.
So this is the idea that came up after talking to her a bit, but the idea of it's okay. This was our theme for Breast Cancer Awareness Month last year, of just saying, oh, sorry, to hear my dog. Sorry, he's like, something's going on. No matter what is going on with you, if it's good or bad or otherwise, it's okay, because we're all in situations, whether that, oh my gosh, do you want to, my dog is the most adorable thing ever, but she's also barking her brain out. Okay.
Oh,
Too.
bring her on the
Oh,
show.
yeah.
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 She just
Stella,
wants to
hold
be
on.
in mommy's lap.
I know.
Yeah.
Come here. Come here.
Oh,
Come
look
here.
at
Come
her.
here.
Oh,
I know.
Oh,
Oh,
yeah. We need a
took my
little
ears
fur
on it.
baby.
This is Stella. She is the greatest. She also is like, somebody is here.
oh.
We
Stella.
dressed her up in a Halloween
Yeah.
costume like the devil she is on the inside.
Oh,
Just kidding. She is the most adorable, great pup. My boys love her more than anything in the world. She's only a little over a year old, but she is.
I love her already.
I know, this is a little
Me
pet
too.
therapy. And she's like, nope, I'm
Very
out of here.
good.
I'm getting down. So anyway, that idea that you're feeling, no matter what you're going through, right? If you are ideally helping other people in the process,
Yeah.
but even if you're getting helped by people and you're still having a bad day, you're watching this right now and you're like, ladies, what you're saying is really lovely, but my day is sucking right now. Like, I feel like shit. There's just no question about it. That's okay. It's okay. It's okay. Because, and Siobhan, I don't know how you're doing it, girl, in the middle of all the stuff you're going through too. Like, it's amazing, right? Because it's like you're waking up every day just being like, listen, it's all right. I'm going to do the thing that is going to drive me, that's going to make me happy on the inside. And that happiness on the inside will hopefully be a healing mechanism, and will come to the outside and will help other people heal in their own ways and their own time as well. So I think
It's
that's a beautiful thing.
it's absolutely that way. I'm doing a vlog, you know. I
Yeah.
actually haven't put up all the vlogs, so I'm having to put the original air date so people don't think that you know
That's all
you
late.
know I was like laid out in the bed the other day, but the next minute I was feeling 100%. So I had a run of a few weeks where I was on top of the world, and you'll see that in the vlog.
Yeah.
4 o'clock yesterday, it was like a truck drove over me. I
Yeah.
had the nausea come on, huge. And now they gave me nausea pills. I've used one like
Wow.
months ago. I'm 4 months in, right into the treatment. John said, take the nausea pill, go lie down. And I went and lay down, and it was getting worse and worse. And then my nose, it was like I kept blowing my nose because it was,
Yeah.
and it felt like that when you blow your nose, you know you've got a cold.
Yeah.
And I'm blowing I used like this whole little thing of Kleenex I had, and I was blowing my nose lying there in the dark, and it was getting darker because it was
Dark early.
dark early now. And I was knowing, John had said, I'm hungry, are we going to have dinner, before I went to lay down. And I was like, I'm not having dinner now.
Oh, no.
And then I was like, oh, this isn't going away. Oh, I've got the flu. I just thought about all these horrible things. And then I run to the bathroom, and I just like,
Yeah.
right.
Yeah.
And I actually did a vlog after that, when I was sitting on the floor with my blanket on, people exactly what was happening to me. But what I did was, after I felt better after I threw up, basically. But I was still kind of like, sort of fluish feeling, but my nose dried up. So it was something that was releasing, toxins were coming out of my body, just like pouring out maybe. And then what I did was I went and lay on the couch, and John's got a little fireplace near his space where he works. And I could hear him working, and I could hear the drone of the fireplace. And I lay down, and I have a blanket and a pillow. He went and brought me a pillow, and I took this plushie. His name's Trouble, and he's adorable. It's still part of the sneak peek, because it's not December, it's not November 17th when we show everybody what these gifts are, but the dog named Trouble. And I just held on to him, and I lay there, and I could hear John. I could talk to him a little bit. He was looking at chat. He was going, this is normal, Siobhan. This is normal. He's trying to calm me down. He said, you're just a week off of your kiss. I'll call it kiss because I can't say the whole name. You're on your week off of kiss. Chat says that's normal. It's a couple of days in, you're going to feel a little rough. And I remember feeling a little rough on other weeks off, but I was not that sick. This one really got me.
It got you.
And my whole night, like I couldn't do any work for the rest of the night,
Yeah.
Totally.
And then I think, as Kelly was saying, like what you're showing us, and we'll begin to look to wrap up as usual. We don't want to stop talking, but we can start to wrap up and just say, it's interesting, that idea of that's okay. You're showing us they're the highs and the lows, and that's okay. You're never meant to pretend, because sometimes not being okay is okay. It is that process and that sharing that builds community, as opposed to this ideal that, yes, we're all in it together. And I'm going to show you that from my particular journey. So that's something that we really admire that you've shared with us.
Truly, I agree with that wholeheartedly, Stacey. That idea that the more that we know about each other's challenges, the easier it is for us to accept our own challenges in the process, right? And I fully agree. Not being okay is okay, because the next day is going to come. It's funny. When we did a social media post that was like, the 5 things that you should say to someone who has cancer, as opposed to like, what did your doctor say? And I'm so sorry. And one of the things was, it's going to be okay. And people kicked back at us saying, like, listen, you don't know what someone's diagnosis is. You don't know if they're terminal. You don't know what's going to happen tomorrow. You don't know. And my response to that is, listen, if you are there holding their hand through this process, we all don't know what's going to happen to us tomorrow, right? We don't know.
Exactly.
We could step out onto the street and a car could do something to us. We don't know. We're all going to go to the same place at the end anyway and figure out where your space is within that belief system, because you need that. All of us do, because we all go to that space, some earlier than others. But ultimately, we can be there for each other. We can collect into this whole that is a beautiful, beautiful space. So if you are there giving that person a hug, it's going to be okay.
Yeah. Yeah. Oh, that's wonderful. Oh my goodness. You know, Kelly, you've touched on me and inspired me so much. I feel blessed to have met you and being a part of this podcast with Siobhan and everyone in our audience. We really want you to go to carakit.com to learn more. That's CARAKIT.com. Learn more. Send a kit to someone you love. You know, that's the point of this. So please also follow CaraKits on Instagram and Facebook. And, you know, we just are so grateful to have had you here, Kelly. And, you know, you remind us what true beauty is, what strength is, and that, you know, courage and positivity, that's contagious. And we're really happy to have you here. So we'll wrap up and say thanks again for today. And thanks so much for our audience. Thank you.
Back at you,
so
ladies.
much.
Thank you.
Thank
Thank
you.
you.